I'm Dr. Sheef, the medical director of KMC. I'm a radiation oncologist, working KMC since 2010, and I'm the patron for this event today.
Please tell our viewers about this event.
Thrombosis in medicine is one of the major problems that we face in hospitals, especially for admitted patients. When the patients stay in the bed for a long time, or pregnant ladies, or patients with pelvic pathology or pelvic fractures, or any fracture in the body, or patient came for delivery after pregnancy, there is instance of thrombosis. Thrombosis is a clot in the veins. And this clot may move from whatever it started towards the lung or any major organ and cause problems, sometimes cause death. So there is a lot of research and maneuvers to prevent this from happening, because prevention is better than treatment. And this is what we're doing now. So the patient at high risk of this problem, which is thrombosis, they start to be medicated either on oral medication or subcutaneous medication to prevent the thrombosis from happening. But this is one part. The other part, to treat the disease when it starts. For example, the patient get pulmonary embolism, which is a clot in the lung, so the patient will not breathe normally and they have difficulty in breathing. So this event especially for the prophylaxis. Prophylaxis means that we try to prevent the thrombosis before it happens. There's a lot of people who are at risk of thrombosis. Example of this, smoker. They are at high risk of thrombosis. Obese people. Anybody who's obese is at high risk of thrombosis. Patient with varicose veins. Patient with previous thrombosis in the past. All patients with cancer, all of those patients, they are at high risk of thrombosis. So those patients, when they come to the hospital, we have to start educating them to prevent the thrombosis event from happening. Alhamdulillah, King Fahd Medical City is the leading institution in Saudi Arabia for this. We have 3 consultants specialized in thrombosis medicine. And as you can see, there is a lot of activities here. All these posters, they are a product of our staff. Medical student, consultant, researcher, therapist, technologist, all of them, they participate in research, and we start collecting data about the incidence of thrombosis in the hospital, and we play a major role in the national thrombosis guidelines in Saudi Arabia. I hope by gathering people in this event, we will educate more staff, especially junior staff, medical students, nurses and other technologists working in hospital, and our target to reduce the thrombosis event in any hospital.
I'm a clinical pharmacist, graduated from the residency program from Saudi Council. Regarding this event, our role as a pharmacist, so we are explaining our role of clinical pharmacist anticoagulation in clinic. Basically, this is our role in this event. So explaining more of the medications, the new oral anticoagulant, what's the role of the new oral anticoagulants in the treatment of venous thromboembolism. This is mainly our role as a pharmacist in this event. And this event, you see that multidisciplinary, physician, nurse, radiographic, and all the health educator that's involved in this event.
What do you suggest to prevent from this disease?
Moving. This is basically that's the only prevention for normal people. But for that we have a certain program that's to prevent venous thromboembolism in the hospital, inside the hospital, and even outside the hospital. We have different programs, different recommendations to prevent thromboembolism.